My name is Dr. Ethan Glazener, and I'm a radiation oncologist here at Cape Cod Healthcare. Radiation oncology provides a unique opportunity for physicians where you combine the opportunity to work really closely with patients on an intimate level. You get to know them really well and walk with them through the journey of getting treated for cancer. And yet it's also highly technical, and so feeds sort of the inner nerd in all of us physicians. So I love how it's a marriage of sort of the technical aspects with the human aspect of treating cancer. For radiation oncology, first off, you have to understand with cancer care, it's really approached with a three-prong approach. Either you're going to be treated with surgery, medicines, or radiation. So radiation is the portion we do in radiation oncology, and that's treating cancers of all types, all throughout the body, of all ages, with really photon energy, which are X-rays. That's what radiation is, it's energy. So as the radiation oncologist, I'm tasked with meeting with the patients, assessing what's the appropriate treatment regimen for them, whether they need to use radiation at all as part of that treatment program. We participate in tumor boards with multidisciplinary teams with our medical oncology team and our surgeons. If we decide that they do require radiation treatment, then it's my job to, one, explain it to the patient what exactly is happening to them, explain to them what side effects they may experience, and then actually do the treatment planning that is required to deliver radiation of a high energy level to a very, very narrow or small target sometimes. So it's my job to meet with the patients, diagnose, give them prognostic information, set them up for treatment, and then oversee them through the entire treatment process. And then oftentimes we're following up with them for years on end, getting relevant scans or blood work that may be necessary to continue to monitor the hopeful remission of their cancer. I love the human interaction. To walk with people. This is the single most important thing I feel that we can do when we're here on this planet, is to care for each other. And I get the opportunity to do that every day. To me, it's a privilege. I don't take it for granted for 1 second. The opportunity that people choose to come and meet with me to hear the advice that I've been trained to give, and I get the chance to connect with them. They're vulnerable, they're in need, they're lost, they're confused, they're trying to navigate this terrible disease, and I get the privilege and the opportunity to be a guide during that time period and a voice of optimism and hope and love. I think that, to me, that's the rewarding part. It's not chalked up in wins and losses, though I do celebrate the heck out of anybody who is cured. Of course, nothing better than remission or cure. But some of the most rewarding experiences have been people as we help transition them to their death. And that sounds really, really sad. And it is. But sometimes it can be done with grace and love. And I cherish all of that, the opportunity to work with the people. My mantra is love and serve. This is what I wake up to. This is the way I want to operate as an individual, as a human being on the planet. And I get to really live that out on a daily basis with the way I approach my patients. Each individual that comes into my office should expect that as the standard from me. Now, what does that mean? Loving can mean that I'm going to see them, hear them, make sure that their voice is heard when they're in the office sitting with me. That I'm going to walk with them through the ups and downs that goes with being a patient with cancer. But serving them, that means taking care of them in times of need, but also doing my job to my best capable level, to always be trying to better myself so that I can be excellent at what I'm doing. Because these patients are coming in and they're meeting with me and they're relying on me to do my job excellently. And so I want to combine that, doing your job excellent, with seeing the human being, serving them, caring for them. But love and serve, that's it. It's the only thing I've ever done that works. What's unique about cancer care here on Cape is that we're one unified healthcare system, Cape Cod Healthcare, with 2 sites where we administer treatments of radiation. One site is here in Falmouth Clark Cancer Center and the other is in Hyannis at Cape Cod Hospital. But this is one unified team. If you get treated at one site, you might see folks that you may see at the other site. We really do go between the two sites, whatever's most convenient for our patients. Cancer care is never done on an island by one physician. The truth is that many different disciplines are always going to be involved in the care of any type of cancer. The relevant surgeons pertaining to that disease site, the radiation oncologist, myself, as well as the medical oncologists who are giving the chemotherapies, immunotherapies, different medicines, sometimes hormone medications. And so we really work together as a team. One of the things we do for almost all disease sites is we have multidisciplinary teams where we meet together and discuss patients. It's rather oddly called a tumor board, but that is what it is. We sit down and talk about people. We talk about these patients as people. We talk about what's going on in their lives, the health issues they're facing, their different socio-demographic, economic barriers they may be experiencing. It's not just physicians, but we have nurses, we have nutritionists, we have speech swallow therapists if that's needed. We really have a whole team approach to anyone with their cancer. And you're going to pull from the relevant people that are necessary for each treatment site. But it really needs to be in collaboration, that everyone's kind of pulling in the same direction, really pulling for longer life, if not cure, of that individual from the disease. I'm fully invested in the community here in Cape Cod. I have a fully thriving family of 3 school-aged children. So my free time is largely built around the activities that they're involved in, whether it's hockey and lacrosse or swimming multiple times a week at the high school. Just enjoying being a father, being a parent, hosting people all the time, coming to see what's to do here on Cape Cod, going out on a boat with my neighbor. I've been so blessed to be surrounded by such quality people and have the opportunity to just explore all that Cape Cod has to offer, and for me and my family.